Hi, I'm Gwen Woods, and I've been working here at the Johnson Center for Pelvic Health for a little over 3 years now. This is our hysteroscopy machine, and what it does is allows the doctor to insert a small scope device into a woman's uterine cavity, and through the camera and the light source, she can see on the monitor all the internal tissue and structures inside the uterine cavity. Then she can either, look for fibroids or polyps and get a diagnosis why a woman might be having bleeding, or she can, zero in on particular cells or objects that she wants to take a sampling of to send off to pathology. And then she also uses the equipment to help with some of her other procedures, like the ablations that we do with women who have heavy bleeding, or we also do a permanent sterilization procedure here in the office, and then this equipment allows her to place the sterilization coils in the right spots in the fallopian tube. So we use it a lot. Then the one down here on the bottom is our urodynamics equipment, and Dr. Johnson uses that to help diagnose women who have urinary incontinence or frequent urination or leaking urine. And it allows her to figure out what the problem might be and whether it can be corrected by surgery or physical therapy. The ablation machine, and that's this one, and it's a ThermaChoice thermal balloon ablation. And what the doctor does with that is she takes this scope equipment, looks inside the uterine cavity, and then puts the balloon device inside the woman's uterus and expands it to cover the entire uterine cavity, and then superheats it to a temperature where it kind of ablates the inside and seals off the blood vessels, so that women have fewer periods and much less menstrual flow. The LEAP machine, and that uses a kind of a small loop electrode device to help take off, it kind of literally burns off the cervical cells or tissue that have dysplasia or precancerous type cells, and then allows the new cells to grow back healthy. And then the last piece of machine, or equipment over there, is called the colposcope, and it's used for our colposcopy procedures, and those are done basically to have the doctor have a better look at the cervix. So she cleans off the cervix and then puts a different solution on, and then through the scope, the microscope, can see which cells are possibly have some precancer or other cellular changes, and then she can do a more accurate biopsy or sampling of those cells, sends them off to pathology, and then does follow-up treatment after that.